Welcome to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a GP for 30 years, now GP lead for 3 Long Covid NHS Long Covid clinics and a GP clinical lead in long Covid across the southwest of England. This episode is on brain fog and long Covid. In part 1, I talk about the symptoms, the diagnosis, investigations and causes of brain fog with long Covid. And in part 2, I'll talk about the treatments, the management and the outcomes. References, links and resources are in the show notes below. Any advice, diagnoses, treatments that I mention should only be considered after discussion with your GP or qualified health professional. So here we go for long Covid and brain fog. Long Covid and brain fog, cognitive impairment, otherwise known as, is common in long Covid. One of the big 3, as I put it, along with fatigue and breathlessness. Brain fog, in my experience in the long Covid clinics that I work in, is a common symptom with my patients, having a significant impact on their lives. So, first of all, the symptoms and associated symptoms. So, what do we mean by the phrase brain fog? Basically, this is a patient-generated term that basically means sort of mentally slow and foggy, fuzzy, spaced out, disconnected. These are all words that our patients use. They say their thinking is like wading through treacle. Patients have difficulties with concentration. They lose thread in the middle of the sentence. They lose word finding difficulties. They say, the word is on the tip of their tongue, but they just can't get there. There's often sort of mild confusion. They do strange things. I had one patient said to me, my wife said, why did you put the car keys in the fridge? Would you believe? But it happens. Very strange things. Patients have difficulties with executive functions. Those are the sort of problem solving and planning and decisions, problems with those sort of things. Patients frequently say that their short-term memories is shot. It's not what they're used to. Their long-term memory is fine, but their short-term memory is just worrying. So what do we do? So first things first, we've got to do a sort of medical assessment, don't we, in order to get to a diagnosis. So that means sort of the history and examination, which is sort of routine for us in general practice. A general history and a general examination to get to a diagnosis. We want to take into account their past medical history, their medication history, if they're on any medicines, their social history, their background. Basically, we want to get a general picture of how the patient was before they had COVID and then the long COVID. More specifically, we're looking for possible differential diagnoses, other causes in which brain fog, cognitive impairment is also a symptom. So what are those differential diagnoses, those other causes for brain fog? Well, the commonest, I suppose, is age-related memory impairment, which, as we get older, all of us suffer from to a degree. Other causes, of course, we all talk about and fear: Alzheimer's disease, dementia, but also other causes for dementia such as multi-infarct, vascular dementia. Other causes for brain fog would be anxiety or depression, Medicines can cause that, especially neurological drugs. Drugs we prescribe for neurological conditions, that is. Diabetes can cause a degree of sort of brain fog because of its effect on the cardiovascular system. There's, excessive chronic alcoholism, Parkinson's disease, vitamin B12 deficiency, underactive thyroid. All these diagnoses and causes can lead to brain fog, cognitive impairment. Having gone through the history with the patient, then it's a case of examination. Usually, in our long COVID patients, there's nothing to find. However, if the patient has brain fog due to one of those other differential diagnoses that I've listed, there may well be findings on general examination. But like I said, there may be no findings at all. Having gone through the history and examination, it's always important to consider the red flags. We must be on the lookout for the red flags. And what do we mean by that? A red flag basically is a symptom or a sign that suggests something more sinister, such as unexplained weight loss. Are we thinking cancer? Excessive thirst and passing more urine than usual. Polyuria, polydipsia. Are we thinking diabetes? Does the patient have diabetes? Massive recent or progressive weakness. Is there something neurological going on? For all these red flags, we'd be obviously thinking better get the opinion, the advice from a specialist, so referral to the hospital. Other neurological red flags that would concern us would be sort of a massive personality change or inappropriate behaviour, new onset or getting lost or dangerous driving, for example, new onset headache. But it has to be said that the new onset headache is very rarely the presenting symptom for a brain tumour. But obviously we've got to take a careful history and sort of pick apart the symptoms. Other neurological deficits such as one-side weakness, double vision balance problems, we'd obviously be worried about a stroke. But those sort of things are more acute. Brain fog generally, particularly with sort of long COVID, is more sort of slow onset, insidious in nature. More often than not, it does come down to a general impression of, getting a general impression of what the patient is talking about and, what the patient has experienced. And you often just get the general impression that something's just not right. So if in doubt, ask. How soon depends on, what you're worried about, its severity and its time course. So there we are. That's the general way we manage someone presenting with cognitive impairment, the history examination, and excluding red flags. Thereafter, it's a case of then proceeding into the investigations. And in our long COVID setting, it's a case of doing the blood tests that the NICE guidelines suggest that we send the patients for. So full blood count, looking at the, looking for anemia, for example, looking at the white blood cells, the infection, the infection, the cells that deal with infection, for example, the kidney function, the liver function, CRP and ferritin for inflammation. We'd like to send blood for thyroid function test and HbA1c looking for diabetes. Those are the baseline blood tests, as I say, listed in the NICE guidelines for managing long COVID. The inevitable question with anything to do with brain brain fog, cognitive impairment, is patients then inevitably ask, can I have a brain scan, an MRI scan? And in long COVID, we do see changes in the brain. So overactivity of the immune system cells, the microglia throughout the brain. We can pick up those little mini micro clots in various parts of the brain, in the temporal region, the hippocampus, the area responsible for short-term memory. We also can pick up other lesions in the white matter, where the nerve fibers. And, studies have shown that in patients with long COVID who have brain fog, there's a reduced or reduction in the volume of the grey matter, the nerve bodies themselves, in areas in the brain such as the hippocampus, as I've said, the memory area, but also the prefrontal cortex, the area responsible for executive functions, those decision-making areas. But, it's not quite as simple as all that, of course. In an MRI scan of in the normal population, the normal elderly population, you'll find incidental changes to do with small vessel disease. Not the same as dementia, but certainly very common in the normal population, where actually they're not presenting with any sort of cognitive impairment or difficulties with their memory, etc. This is just a normal finding in a brain MRI scan. In Alzheimer's disease, obviously, we see shrinkage of various areas of the brain in a sort of classic generalized global picture. Likewise, dementia due to multivascular, multi-infarct dementia. There's white matter changes scattered throughout the brain. Again, it is very characteristic. It's different to the Alzheimer's picture. It's different to simple aging picture. And again, it's different to the changes that we see with long COVID patients. So, a brain scan will be helpful to a degree, but, it's not going to change the management of the patient. It will be the same whether it's any of those diagnoses. But nevertheless, it's helpful to know what we're dealing with. It's important to know what we're dealing with. But mild cognitive impairment, we're seeing it so often. As I say, it's one of the big three in long COVID. And so it begs the question, well, just how useful is an MRI scan of the brain in that context? If it's severe, yes, I think it is valid, and I think it's a worthwhile doing. But if it's mild, I question the value of that. Having talked about scans, what else do we do in the sort of the investigations or specialist tests, etc.? We can do a cognitive assessment. There are a number of screening tools, about half dozen screening tools, validated screening tools, to look at mental function, to assess, your mental function, your memory, your decision making, etc. The one that's used more often than not is the Montreal Cognitive Assessment, the MOCA, so-called, which takes about 10 minutes to do, a panel of 30 questions. It's standardized, as I said, and validated. And, someone who scores less than 26 is said to have mild cognitive impairment. It looks different. This test looks at different parts of the brain, but it's quite crude and insensitive. And most services, actually, most long COVID services, certainly the services I work in, really don't subject their patients to that any longer, because it's not overly helpful. So all in all, investigations wise, the majority of our patients with long COVID, all their investigations are negative. Some patients are keen to have an MRI scan, but like I said, as long as you've ruled out differential diagnoses and red flags, really an MRI scan is not going to really be that helpful. It's probably not necessary. Obviously, if there are concerns, the degree of brain fog is extreme, there are worsening symptoms, there are red flags, you need to refer those patients to, either immediately or soonish to the hospital for, the neurologist to assess. They, of course, will either probably say, well, on balance, in this situation, in this circumstance, with those sort of worrying features, a scan would be necessary. However, as I've said, most patients with brain fog will not need this, or won't need referral to the specialist even. And so we're left with a diagnosis of brain fog as a result of the long COVID. So, before I go into the management of that, management of brain fog, long COVID, that will be in my sort of part 2 of my talk. And I sort of think it's important to explain the causes for long COVID brain fog. I think it's important to know the causes because it helps, and I think it's important for patients to know the causes because it helps our patients sort of understand and hence accept the problem. It also reminds our patients of the complexity of long COVID, all the things that go wrong in long COVID, and hence the reason why fixing it is never going to be possible with doing just one thing. And so what are the possible causes, what we call the pathophysiology for brain fog in long COVID? So hold on, here we go. There are lots of causes, of course, you know that already. The virus, the coronavirus, the SARS-CoV-2 virus causes a lot of damage on so many levels. There's a list of 1, 2, 3, 4, 5, 6, 7, 8, 9 coming up. Basically, viral damage directly from the virus itself that's actually got it into the brain. Okay, and it does this through the nose, through what's known as the cribriform plate at the base of the skull. The nerve fibers, the smell fibers, the olfactory nerve fibers travel through from the nose mucous membrane into the brain itself. So the virus can get into the brain directly, into the what's known as the olfactory bulb, and then on into the limbic system, where all sorts of things can happen. I'll talk about that later. Then viral damage can happen directly to the brain, sort of through indirect invasion. So the virus gets into the circulation, it's picked up by the white blood cells, the macrophages, and then those macrophages can be then cross over into the brain itself in the bloodstream. They call this the Trojan horse method of the brain being infected with virus. And then there's inflammation problems. Again, we've talked about this many times before with mast cell activation, inflammation of the blood vessels leading to leaky blood-brain barrier. There's inflammation leading to cytokines, the pro-inflammatory mediators, either leak in from this leaky blood-brain barrier or are released from the brain's own immune tissues. Then there's inflammation leading to sticky blood, hypercoagulopathy, which leads to microclot formation, as I've said before in other podcasts and postings. That leads to mini blood clots here, there, and everywhere, and the brain is not exempt. They can happen in the brain also. So those are the inflammatory causes. Then there's the immune problems that can occur with autoantibodies, antibodies directed against our own normal cells, and there are autoantibodies against, wait for it, normal brain cells, nerve tissues, leading to its own sort of inflammation and damage. Then there's vagal signaling from the periphery, tuned into the brainstem, triggering inflammatory response in the brain. And then finally, there's sort of dysfunction of the autoimmune nervous system, an effect on the sympathetic and parasympathetic nervous systems, the hypothalamo, pituitary, adrenal axis, the limbic system, brain cell nuclei. Any of these places will, any of these parts in the brain lead to any of these dysfunctions. And also the sort of the control of the nerve glandular system, the nerve and hormone systems, they can be disrupted as well. So that long list, in someone who's had COVID, any patients with long COVID can have had any of those things happening to them. But to add injury to insult, insult to injury, basically there are other contributory factors that can lead to brain fog or may worsen the brain fog, and that is sleep disruption. So many of our long COVID patients have sleep disruption, either can't get to sleep or have interrupted sleep or wake up early, nightmares, vivid dreams. All these things our long COVID patients are telling us. But with sleep disruption, then the sort of the day-night cycles disturb, circadian rhythm disturb, which is really important. I'll talk about that a little bit later. Apart from sleep disruption, there's disturbance and imbalance in the gut microbiota. Studies very clearly demonstrate that patients with long COVID have a disturbed or dysbiosis, overgrowth of unhealthy rather than friendly, healthy bacteria in our gut. This is bad news, because a healthy microbiota, the gut flora, the friendly bacteria, is so important for general well-being, for support of the immune system. And we know about the gut-brain axis and the interactions between the gut and the brain. That's all disturbed in long COVID. Again, more on this a bit later. And then there's the impact of long COVID on mental health. Those understandable worries and stresses, the anxieties, maybe even depression, those understandable consequences of long COVID, such as, fear of never getting better, or the effects it has had on the family and the social life and job and financial status, all those socio-economic factors. All these, of course, have an impact on cognitive function, cognitive impairment, and hence brain fog. Not good. It's complicated. So, thinking about the causes, one patient may have one of those many processes going on, the inflammatory process, or the direct invasion bit, or the immune bit, or they may have two or three, or they may have all of those processes going on in their long COVID, contributing to their brain fog. It's little wonder that long COVID causes so many symptoms. There is little wonder, is there? All those symptoms across so many systems throughout the body. It's complex. It's the perfect storm. Not good. So, there we are. That sort of wraps up the first part of my talk on brain fog and long COVID, the symptoms, diagnoses, and all those causes that I've painstakingly described and outlined. So in the second part I'll talk about the treatments, the management, and the outcomes. I hope you found that helpful. As I mentioned at the start, any advice, diagnoses, treatments that I've mentioned should only be considered after discussion with your own GP or qualified health professional. So, in the meantime, until part 2, I wish you all well in your recovery from long COVID. Thank you.